Hi. Welcome to CDHA Coffee Chat. I'm your host, Dr. Brad Kelln, and each week I'll be inviting you to come along with me as we meet new and exciting members of the Capital District Health Authority team. Today we have with us in studio Don Smyth.
Dean Smyth.
Dean Smyth. Dean Smyth works, where do you work, Dean?
I'm, aren't we supposed to have coffee?
Let's move on. What do you do?
I am an infection prevention and control practitioner with the Capital District Health Authority.
Interesting. Tell me a little bit about what does an infection control and prevention specialist, is it a specialist or is it more of a generic view?
No, we're specialists.
So you're a specialist. So what does, and you have high school? You finished high school?
Yes.
Okay, so what does an infection prevention and control specialist like yourself, what do they do on a day in and day out basis? I imagine it's exciting, interesting things that our viewers will want to hear about.
Well, yeah, we do many things in infection prevention and control. One is that we conduct surveillance and we keep our eyes on, for example, antibiotic resistant organisms. We also track and help prevent outbreaks of particular nasty illnesses like Norwalk or chickenpox or pandemics.
Let's move on. So you do a lot of different things. What's the current sort of thing that infection prevention control's really got their hands into?
Oh, that's a good question, and one of the reasons why I'm here today is to get out to our employees about the 4 moments of hand hygiene.
Hand hygiene. Hand washing. When you say hand hygiene, I mean for the lay people watching this, people that aren't specialists. Hand hygiene is hand washing?
That's part of it. Cleaning your hands. Hand washing is generally connotated with washing under soap and water, but hand hygiene can include alcohol hand sanitizer as well.
Does that make your hands smell boozy?
What?
Let's move on. 4 moments, you mentioned 4 moments of hand hygiene.
Basically, what we say by 4 moments is that for a healthcare provider, and we're trying to stress it to the healthcare provider, one is that you wash your hands before going into a client or a patient's environment, bedside or room or what have you.
That's number 1.
That's number 1. The second one is...
Less important. Number 2.
No, not less important. Equally as important.
Number 2 is just as important as number 1 in this case. It's not a hierarchy list. Go ahead.
That's right. The second one is before doing any aseptic tasks, such as even if you're in the environment and you go to do a dressing.
Yep. Number 3.
Okay, so number 3 would be after your hands or your hands become soiled with any bodily fluids, such as blood, for example. And 4th would be when leaving the patient environment. So these are the 4 moments that we typically talk about. Most people do the after, it's the before sort of situations that we're trying to get people to...
Right. So those are the 4 moments. I think that's you've laid those out nicely, and I think it's... probably important people know that. So I'm also curious, because as you said, you finished high school, and
Yes.
There's probably a number of really tough workshops and things one goes through in order to get to be a hand washing specialist. I'm wondering if...
We're not a hand washing
Just a second, let me finish my question. What if someone comes up to me and says, Dr. Kelln, you're a highly respected clinical psychologist with a real education. I, on the other hand, I would like to be a hand washing specialist. What can I do to get into that field? I'd be at a loss. What did you do to get into the hand washing area of expertise?
I got an undergraduate degree in biology.
Community college. Finish high school.
No, Dalhousie University.
Dalhousie University is an appropriate venue.
Then I did my undergraduate and got my baccalaureate degree in nursing.
So you're a male nurse?
Yeah, female nursing school was full that year. Where's that coming from?
Let's move on. So you have to be a male nurse. You have to have finished high school.
And then you have to do your specialization in infection control.
That's great. Fantastic. Well, that's all the time we have today. So I really want to thank Dean Smyth for being our first Dean Smith for being our first guest here on CDHA Coffee Chat. In the future, we're going to have more guests where you get to meet people and hear about, hopefully, interesting careers and interesting job opportunities and interesting things going on in Capital District Health Authority. So for today, I'm Dr. Brad Kelln saying thanks and see you again real soon.
I really was expecting some coffee.